All right, so I want to thank everybody for coming. This is Dr. Naylor, Dr. Andrea Naylor, and my name is Jennifer Phillips. I'm a physician assistant, and I've been starting a project called SophiMed Wellness. And we wanted to do a talk on heart health because February is Heart Health Prevention Month. So we want to talk a little about heart disease. So why talk about heart disease? It is the #1 cause of death for men and women in the United States. A lot of times women don't think that's true. They think we hear a lot about breast cancer and other causes of death, but heart disease is one of the primary causes of death in women as well. But a lot of it is preventable. If we can kind of get ahead of the game, we can do a lot to prevent this from occurring or getting worse. So I always like to talk about anatomy, even though a lot of you know, because I think it's important to know about the organ that you're talking about or the system you're talking about. So the heart has 4 chambers. It has atrium, to the right and the left atrium on top, and then the right and left ventricles on the bottom. And basically, blood from the venous system, from your legs, your arms, your head, all of that comes down to the right side of the heart, into the right atrium. Then it goes through a valve into the right ventricle. Then it passes out into the lungs, gets oxygenated, and then comes back to the left side of the heart through the left atrium, into the left ventricle, and then it pumps out from the left ventricle through the aorta to the body. So just so you kind of have some familiarity. And so what is heart disease? Heart disease is problems with the heart in many different facets. So it's kind of an umbrella term. It talks about coronary disease, high blood pressure, abnormal heart rhythms like atrial fibrillation. It can be abnormal heart valves or weakened heart muscle. So we'll start with coronary disease. So you probably know what coronary disease for the most part is. We know that it's usually the narrowing of the arteries of the heart, usually from cholesterol and lipids and plaques that build up over time and start to cause narrowing, and eventually can cause a narrowing enough that it restricts the blood flow through that vessel. So how does this occur? A cool video, a sort of video, from the American Heart Association. Thought this was very good. I didn't even know all of these details. So, as you know, we've probably heard about cholesterol. There's bad cholesterol, which is LDL, and then good cholesterol, which is HDLs. So the LDLs are bad guys. They go through and they look for injuries to the inside of that vessel. When they find those injuries, they deposit little particles of cholesterol in there. And so then your immune system is like, or your body is like, whoa, what just happened? We need to find out what went on and send some troops there to figure this out. So they send these little soldiers there and they're like, oh, well, this is a foreign object. We need to start trying to get rid of that. And so they start kind of eating the cholesterol and taking it in, and eventually they get filled with these cholesterol deposits and little lipids, and they form what's called a foam cell, which eventually gets larger and larger over time. And eventually, those foam cells actually die off, and they release a lot of pro-inflammatory components into the area, which can then lead to what's called plaque weakness, or there's usually a little fibrin cap over that plaque, if I can get to my spot. And then you can see where you can develop a fracture. They call them plaque fractures in the area where the plaque builds up. And then what happens after that, again, your body's like, whoa, something just happened. And so it sends different types of troops into the area, actually kind of maintenance guys, which I would say are kind of like bricklayers. They go in and start laying bricks kind of over this injury, but those bricklayers, better known as platelets, and those platelets eventually collect over that area, and sometimes they get a little too aggressive and they can actually block that artery off. That's why it's so important to take aspirin at the time you think you're having a heart attack, because what aspirin does is basically goes in and takes the cement away from those bricks so that they can't stick together, and those bricks can just kind of hopefully float down the vessel and not block off that artery. So that's kind of how the whole process occurs. Hold on. So what are the symptoms of a heart attack? So with men, it's pretty classic for the most part. They have left-sided chest pain. They feel the squeezing sensation within their heart. They can have shortness of breath. They can sweat profusely. I remember one time we took a guy to the cath lab just because he was sweating so much. He was young, didn't really have any other symptoms, but felt something was wrong, but they were just sweating like crazy. He ended up having a blockage. They a lot of times can get the jaw pain and left-sided arm pain as well. Women, it's a little different. It's not quite as obvious. Sometimes they just feel really tired. They can have upper back pain, nausea, indigestion, some shortness of breath, some sleep interruption. We definitely had some women that would have that in the hospital. Left breast pain. I once had, I used to do a breast clinic in Seattle a long time ago, and she referred a woman that was in her early 70s, and she was like, yeah, I have this left breast pain. It just kind of shoots out of my breast. And I'm like, oh, okay. And you always ask the questions, you know, what brings this on? How does this occur? I goes, well, I was out gardening, and I don't know, all of a sudden I just had this shooting breast pain. And I rested and it went away, and then, you know, she's like, a couple days after that, I was walking to my mailbox. I thought, well, this is not a breast issue. This is a heart issue. But women sometimes just present differently, and it's not necessarily as acute. So something to be aware of. What are the risk factors? So the things we can kind of have an effect on. The ones with the red first letter are the three biggest. Smoking, of course, is top. And it causes a lot of problems. Excuse me, on one of the handouts that I had made, I put down a bunch of the reasons why smoking can do that, but just because I think a lot of times people think we pick on them because they're smokers, but there really are a lot of physiologic reasons that smoking is very bad for your arteries. It causes increased risk of those little injuries to the inside of the vessel, so that those little LDLs can deposit those plaques in there. It causes increases inflammation. It actually causes more of those platelets to be stickier, so they kind of increase the amount of cement that's in between those bricks and cause increased risk of clots. Diabetes, definitely high risk. Some of the same reasons with smoking. Inflammation. Now, if your hemoglobin A1C is pretty well controlled, under like 6, lower risk, still higher than somebody who doesn't have diabetes, but definitely way less than it would be. 6 to 7 is moderate risk, and over 8 certainly gets higher and higher. But a lot of it is the inflammation, kind of increase in LDL distribution, so the higher percentage of those bad cholesterol, the higher percentage of those little guys putting deposits in your arteries. Hypertension, having good blood pressure control is really crucial for coronary disease. You definitely are. Hypertension is one of your things for sure. So it's very hard on the inside of the vessels. The higher that pressure is, it increases the risk of injury to those vessels. And again, as we know, those LDL, like those little injuries, and they deposit little cholesterol in there and increases your risk significantly. Hyperlipidemia or cholesterol, we kind of talked about that. Truncal obesity, unfortunately, when you gain your weight right in your belly, that visceral fat is, for some reason, very pro-inflammatory. And so people with what they call metabolic syndrome or have an apple-shaped body tend to be at much higher risk for a lot of these issues. Inflammation risks, diabetes, insulin resistance, a lot of those things. A sedentary lifestyle definitely increases your risk as well. Your arteries kind of want blood flow to be going through them. You need to be out moving around. It helps the endothelium lining be more relaxed and work better. Unhealthy diet, we know a lot about that. So we've been talking about unhealthy diets forever. It's funny, obviously I used to live in Seattle, I mentioned that before, but I moved out there in 2005, and Seattle is the land of documentaries. So back then, there were all these documentaries about whole foods and how to eat all these right foods and vegan diets and all these different things. And it's funny, that was 20 years ago. And our diets are worse now in some ways than they were even back then. You know, it's pretty fascinating. And I was learning recently that there's suggestion that even some of the food companies try to alter things to get you to buy them more. Now, is that true? I don't know, but you've heard more talk about that recently. It's not surprising, you know, it's all marketing, but it's pretty fascinating. And then, of course, family history. How do we diagnose coronary disease? So in the acute setting, when you think you're having a heart attack, you can get an EKG. Can be done in the ambulance by someone like Kevin, my husband, who is her paramedic. Who was the other? Or in the hospital for sure. You're also going to get labs done in the hospital. They're looking for an enzyme called troponin, which is an enzyme that gets released from the heart muscle when the blood supply to that heart muscle is not sufficient. You can have, if you're just looking, say your primary is trying to see if maybe you have underlying coronary disease, you might get a stress test that can look for abnormal blood flow to the heart muscle. If that stress test is abnormal, you might get a cardiac catheterization, which is where they do an angiogram. They go in through either a femoral artery or an artery in your wrist, and they put a catheter up there and put dye down the coronary arteries to look for blockages. They can also, nowadays they do a lot of coronary CT scans. Those are a CAT scan, but they look specifically at the heart arteries. It's really somewhat patient specific though, because you can't, as you get older, you have higher levels of calcium within the coronary arteries. So they generally aren't going to do them in people that are 70 or 80 because they're not going to be as accurate. But young people who kind of have, you know, differing symptoms that you're like, I'm not sure, a lot of times they might go for a coronary CT scan to kind of look for any increased evidence. And then you might also end up with a heart cath if they see that, but coronary CT is a good screening. Echoes are a good way to look at how the heart muscle functions. So not necessarily in the acute setting, but they can see if maybe you had a heart attack, that your heart muscle has been weakened, or maybe there's some abnormal stuff going on with the heart valve. And this is what an echo looks like. The heart in this picture is upside down. So the ventricles are on the top at the pointy part, and the atrium are at the bottom. And the little things you see flapping in there, those are the valves. So it really gives you a great picture as to how well the heart valves are working and how the heart muscle's working, and just a good diagnostic tool for a lot of things. Treatments. So again, acute heart attack kind of has its own thing. Aspirin we talked about, it helps really break down that clot or not allow those platelets to stick together. So you want to take a 325 milligram aspirin or 4 baby aspirin. So which people have, right? Which most be, and baby aspirin a lot of times people have. So 4 of those is 324 milligrams, but you still want to take those. And then you want to tell your paramedic who shows up at the door what you've taken, so they don't stick a whole bunch more aspirin in there, or maybe they do, but you always want to be able to tell them what you did. Mona is more of a healthcare thing. People at the hospital, those are different drugs like morphine, oxygen, nitroglycerin, and aspirin. But most likely, if you have an acute heart attack, you're going to end up in the cath lab, and you might very well get a stent placed, which is, as you can see, kind of a metal scaffolding that helps open up that artery and allow blood to flow through that artery more freely. Long term, if you have diagnosed coronary disease, it's recommended to have an aspirin, or I'm sorry, not just coronary disease, but peripheral vascular disease or carotid disease, some type of vascular disease, to take a baby aspirin every day. But if you don't have diagnosed disease, then it's not really recommended as a prevention any longer. Medications, there's ones called beta blockers, which are like metoprolol or Coreg, bisoprolol. Then there's ACE and ARBs. Those are all just a class of medications. That is, some examples are lisinopril or losartan. And then there's antiplatelets. Those are the ones that kind of work like, well, they do work like aspirin. They don't allow those platelets or those bricks to stick together as well. And so you get those when, often whenever you get a stent, sometimes you just get them as treatment patterns as well, but definitely after a stent you'll get them placed, or I mean you'll get them prescribed, and that can be like Plavix or Brilinta or Effient. Cardiac rehab is shown to be very beneficial for people after heart attacks, so definitely recommended to go to cardiac rehab. Sometimes ultimately you might have surgery or bypass surgery if, say, they can't put a stent in, or you have multiple areas that have blockages. So it's possible you can end up in surgery. A long-term treatment also is controlling your blood pressure, type blood sugar control, and quit smoking. So I just thought this kind of deserved its own slide because GLP-1s are so prominent nowadays. And so as I was looking through this, of course GLP-1s can reduce blood sugar, and they can also reduce weight. So those in and of themselves can improve your risk for heart disease. But what I was also finding out while doing this research is that GLP-1s just by themselves reduce your risk of heart disease. There are GLP-1 receptors in your arteries, in your heart muscle, your brain, your kidneys, all over the place. And so they help improve how the endothelium, which is the inside of the arteries, the lining within the arteries themselves, those ones that can be injured, where the LDLs kind of place those little cholesterol particles, it helps with that. It helps the heart muscle relax more. I'm trying to think what else. Oh, it decreases your LDL, so it decreases the percentage of those LDLs floating around within your system. Pretty impressive. I was surprised. Not surprised, but kind of surprised. Impressed, I should say. So, oops, sorry, jumping in there. So prevention's kind of with the long-term treatments, but obviously quitting smoking, good nutrition we kind of talked about. Following the Mediterranean diet is still highly recommended for heart disease. It's been recommended for decades, but it's still really the best diet pattern that they found, unless you're a strict vegan. Those have shown some reversal in studies, but that's not like the Impossible Burgers. Those are the things that are processed. That's true, like making your food, being a vegan, truly through that pattern, which is not as common. But the Mediterranean diet is a great way to go. So interesting also about GLP-1s, as I was doing research, there's a lot of foods that actually have GLP-1 components to them. And what's fascinating is that a lot of them are the Mediterranean diet. I thought, oh, that's pretty cool. So, yeah, lots of vegetables. Yeah, I have a list over there. It's pretty interesting. Type blood sugar control, of course, if you have diabetes. Again, aspirin if we have known vascular disease. Knowing your numbers is important. Know your blood pressure, know your cholesterol numbers so you can be educated to try and combat those issues. So I put in HRT stands for hormone replacement therapy. So this is becoming more prominent currently because people are talking about back in the day when the studies were done in the early 2000s, there were a lot of times they didn't prescribe estrogen and progesterones because they thought there was increased risk of coronary disease and strokes. So the studies were skewed and weren't completely accurate. They're now showing that there may be some benefits for coronary disease if you start prescribing them within a certain time frame. So it's within 10 years from menopause and under the age of 60. It's not guideline-directed therapy. There's just suggestions, and that research is still ongoing, so it's not a recommended guideline, but it's interesting. And family, of course, start early. A couple other ways for for prevention of heart disease. Normal BMI, which I'm working on, and then manage your stress levels, and then exercising, 150 minutes a week, 30 minutes a day of moderate or even 75 minutes a week if it's a more higher intensity definitely have shown, and that's been for years, that's shown a benefit for decreasing your overall heart disease. And that leads me into Dr. Naylor, her part.
Jennifer. Yeah. All right. Welcome, everybody. So my plan is to talk about how we're going to manage the stress that affects our body and our brain, and can increase our risk of these other medical issues that Jennifer's been talking about. And we're going to be talking about how we do that through movement, but some other ways as well. So stress, there's a definition up there. It's normal, it's natural for our body to have a response to stress when changes and challenges occur. And a little bit of stress can actually be good for us as we're trying to navigate life, do presentations, get ready for a test and things like that. And so your perception of the situation, your mindset make a difference. So I have those two pictures up there, you know, they're both working at computers. Obviously one looks stressed and the other one looks happy. So people can manage the same situation slightly differently. So staying positive and you know, managing the situation is important. There's just a sample of sources of stress. I mean, we could probably add, you know, pages and pages to that list from different situations that we've encountered over time. But from the list, you can see that there's some things that are, you know, time specific or, you know, happen in a short period of time, like studying for a test or preparing and giving this presentation, or having an argument. So that's, you know, something that happens in a short period of time. But then we can have other things like financial strain or illness or, you know, change in marital status, etc., that can be way more stressful and over a longer period of time. So learning how to manage those situations is important for decreasing your risk of how the stress affects your body. So our body responds to stress with different kinds of responses. So we're all, I think, probably have heard of the fight or flight response. So fight, obviously, we're aggressively, you know, managing the challenge that's coming at us. We're going to fight. Versus flight, where we're going to remove ourselves from the situation and get out of danger. They've also started talking about freeze or fawn responses, which I thought were, you know, obviously freeze, you're frozen, like you are stuck, you can't think, you can't act, you can't move. And then the fawn response was something different for me to understand. That was you were basically going to try to bargain or appease, you know, the situation, try to do something to avoid the conflict or the challenge that's presented to you. But these are normal responses that are automatic. Our autonomic nervous system goes through when we're presented with a challenge. So you can see some of the changes that happen to your body when those challenges occur. All of those things are normal and are, you know, self-preservation basically. And once the challenge or the stressful situation is removed, our bodies should settle down after like 20 to 30 minutes. But we all know that, again, some of those situations that we were on the previous slide are longer term, and sometimes we don't have that settling down situation happen after a challenge has occurred. And that's when we get some of these other symptoms. And again, we could add probably more to all of these lists, but you get physical symptoms, psychological symptoms, and then, you know, behavior changes that are helping, not helping, they're just your body's response to that stress not being managed or happening over a longer period of time. But we can fight it. And we can fight positively and reduce our body's response. So just some basic stuff to start off with. So self-care, daily care. So some of the things that Jennifer's already talked about. So having a good balanced diet, finding your way to do your exercise or your activity to get your heart rate going every day, and then getting good sleep. That's huge, and it's probably going to come up probably with some of the other topics that you're going to talk about in a little bit, probably sleep affecting that. So staying positive, just, you know, trying to find the bright side of the situation, which is not always easy and takes some practice, but it can happen and make a difference. practicing gratitude, relinquishing control. This is something that spoke to me as a Virgo who is used to being in control of, or trying to be in control of everything. You let it go, right? If everybody's heard, what's her name? Mel Robbins. That's her phrase. Let it go. You are trying not to be in control of every situation because you are going to be less stressed because of that. And then learn to say no. Also a challenge for some of us to avoid adding on extra stress, extra activities, and extra responsibilities that are gonna weigh on you. Other things that we can do to manage that stress. Talk therapy, whether it's with family or friends, or with clergy, or medical professional, mental health professional. Getting out and doing your hobbies, whether that's puzzles or writing or art, crafts, things like that. Prayer for sure has its place. Journaling, helping you manage some of those feelings and staying connected, especially to people who have a good positive influence on you and are supportive, will make a difference. Other things that we can do to manage the stress: deep breathing, meditation, and then I listed some apps that on one of the handouts that can help you with the deep breathing and the meditation as well. But all of these things that we've just talked about, especially the meditation and the deep breathing, are how we intervene in our body to help reduce the stress response. And there's 4 types of deep breathing there. At the bottom of the slide, the alternate nostril breathing, the box breathing, the diaphragmatic breathing, and then the 4-7-8, which I have used a lot. I really like that, and I thought if anybody wanted to, we could practice doing that. And I don't want to put anybody to sleep, but it really does make a difference with getting you to relax. And again, helping you lower your blood pressure, which we just talked about how important keeping the blood pressure under control is in preventing heart disease and maintaining preventing heart disease. Decreasing your heart rate and reducing muscle tension, so it's going to make a difference with pain management and stuff too. So has anybody done this 4-7-8 breathing before? If you're going to do it, you should probably sit.
Oh, all right. Yeah.
So everybody just kind of get comfortable in their chair. And so you can see the steps. So we're going to inhale through the nose for 4 seconds, hold our breath for 7 seconds, and then exhale through the mouth for 8 seconds. And then we repeat it 3 times. So I'll count and take you guys through it. And you could, if we wanted to, we could do a pulse check before and then after. But anyway, just practice the breathing. I have found this really, really helpful. And if anybody knew, my husband, Guy, was like, this is the breathing technique that he taught for a lot of his patients that he worked with over at Harbor Hall, especially for managing stress and anxiety, etc. All right, so everybody get comfy. Hands wherever you would like them to be. And we're gonna go ahead and start with our inhale, slowly for 4 seconds. 1, 2, 3, 4. Holding your breath for 7, 6, 5, 4, 3, 2, 1. And exhale through your mouth for 8 seconds. 7, 6, 5, 4, 3, 2, 1. And if you can't quite get through all of those seconds, do the best you can and then restart with us again. We're going to go ahead and do inhale slowly through your nose for 4 seconds. 1, 2, 3, 4. Hold your breath for 7, 6, 5, 4, 3, 2, 1. And then exhale through your mouth for 8, 7, 6, 5, 4, 3, 2, 1. We'll do it at least one more time here. Inhale for 4 seconds. 1, 2, 3, 4. Hold your breath for 7, 6, 5, 4, 3, 2, 1. And exhale through your mouth for 8, 7, 6, 5, 4, 3, 2, 1. And then you can return to your regular breathing. So you can use that anytime that you're feeling stressed, so in an acute situation, feeling anxious, but you can also maintain this kind of practice on a daily basis, which helps you cope, and just not get to that level of stress as quickly as you would otherwise. Meditation is another way of influencing your body's response to the stress. Research actually has supported that it does have some positive effects on the body and the brain. And there's so many different styles that are out there. There's not one that's considered the best, so trying different kinds is what is generally recommended until you find something that kind of speaks to you and is comfortable and you feel like you can enjoy and get benefit out of. Some of the rules that you're actually supposed to follow while you're trying to meditate, and it's a meditation practice. Most people who educate on meditation will talk to you about practicing it because it's not going to be perfect. You're not going to be good at it right off the bat. And so some of the things that they want you to do are to want nothing. So you don't have any expectations of your session that you're doing at that moment, or of your future of meditation. You're just supposed to be present at that moment. Do nothing. So you're not supposed to, you're trying to not think, breathe, move. Well, breathe, you are definitely breathing. Not thinking, not moving, just trying to be present in the moment and to be nothing. Again, not have expectations, not have any ideals. You're not supposed to look a certain way or act a certain way when you're doing it. So you're just really open to what is present at that moment for you. And I myself needed some guidance with that. And trying to, I use some of the apps, the Headspace app specifically to help guide some of the meditation, but there's so many different educational tools out there, especially on the internet. You can find anything, of course, but that will help guide you through that. And eventually, hopefully, if you practice on a regular basis, you're getting some of that good relaxation effect and, again, the good mind-body control as well. But we wanted to talk about movement specifically, and so Jennifer already alluded to some of the particulars about exercise that are important, but one of the things that you need to do when you're picking an exercise to be able to maintain on a regular basis to try to find something that you like. And the good news is that we have a ton of options up here. Yoga, Pilates, multiple ways of aerobic exercise, including running, tennis, etc. Tai Chi, weightlifting, yard work, dance. I mean, there's so many options that are available to you. But again, the key is to find something that you enjoy so that you can maintain it on a regular basis. And specifically, we're going to be talking about aerobic exercise and resistance training as the two types of exercise that show benefit over and over again in reducing your risk of cardiovascular disease. So aerobic exercise is something that gets your heart pumping, but you can still breathe while you're doing it. And again, Jennifer spoke to the requirements, which are at least 30 minutes 5 times a week, 30 minutes per day, 5 times per week. The resistance training also has benefits for the body, and you want to do that at least 2 non-consecutive days per week, and it can be added on to the aerobic exercise. You don't have to do it at a separate time. And then flexibility training is important for helping you maintain your body's good function. So it can reduce muscular pain and joint pain and helps you continue to do the aerobic exercise and the resistance training. Let's see, I feel like there was something else about that I wanted to talk about. So what the aerobic exercise will do for you is improve circulation, so it's lowering your blood pressure and lowering your heart rate. And improves how well your heart pumps, which is going to be good for some of these other diseases that Jennifer's still going to talk about. And it helps control glucose and reduce your risk of diabetes. Again, one of those important factors in decreasing your risk of cardiovascular disease. And then when you do the resistance training, so we're doing muscle work, we can do that with weights, with machines, free weights. We can do it with bands. We can also do it with weight-bearing exercises like doing push-ups or squats and things like that. And the more muscle you have, the more calories you're burning throughout the day as you're moving. So you're, again, reducing risk of vascular disease as well as the diabetes over time. And specifically to those two types of exercise together, the aerobic and the resistance training, both will help increase your HDL and lower your LDL. So important components of reducing your risk of heart disease. some of the frequently asked questions. What is moderate exercise? So again, I talked about that a few minutes ago. Activity that makes your heart beat faster, but you can still talk while you're doing it. So a nice brisk walk, sometimes going up and down stairs, playing tennis, pickleball, etc. All of those things that we listed earlier. And then where should my heart rate be? Because we talked about making your heart beat faster. So your max heart rate and then your target heart rate are based on age. So you can see the formula that's up there, and basically for someone who is 50 years old, we're talking about a heart rate of like 85 to 140 generally is what you're looking for to get into when you're exercising. And I do have a handout over there that has that calculation listed on there with an example if that's something that you wanted to look up. It's also available, anyway. American Heart Association, I definitely found it there too. So what if you have joint and muscle pain and you're trying to start exercising? Walking is almost always something that somebody can do, but if you have a lot of arthritis in the lower extremities or your back, sometimes exercising in a pool to start can help get you going and actually decreases the load that's on your joints and maybe more accessible to start off with. But if you're having trouble, then definitely want to be talking to a medical provider for advice. And sometimes we have to start with a supervised or a guided exercise program with physical therapy. And so if somebody was already told they have heart trouble, how should they start exercising? Well, more than likely, hopefully, your medical provider who told you you had heart disease is telling you what risks you have and how you should start. But sometimes the cardiac rehab that Jennifer mentioned earlier is necessary, especially after an event, to monitor your heart rate and your blood pressure and your perceived exertion when you're doing exercise to make sure that you're safe with your heart problems. And then I just listed some of those symptoms that Jennifer listed earlier with the man and the woman slide that showed some of those red flag symptoms that we definitely want to pay attention to and get help for if we're having, especially during exercise. So I also, in the handouts over there on the table, also gave a list of the resources that I could find documented as still active as far as some of the options that we have in the Petoskey area, which are like so numerous. The whole back of a page has places where you can do yoga, Pilates, trail walking. The classes at the Friendship Center are pretty awesome, and there's a bunch of gyms and such too. So taking advantage of, again, whatever speaks to you, whatever sounds like it would be fun for you so that you can maintain that kind of exercise on a regular basis is really important. And these were some of the resources that I used to help put some of these this information together for you, and I've listed that, I think, also on the handout as well. But basically, use a lot of major institutions here, especially the American Heart Association, which gave a lot of great information. So happy to answer any questions. I believe that's the end of mine, yes. So Jennifer will take over, but I'm happy to answer any questions and give advice on the exercise and stuff too, if anybody needs it.
All right, thank you very much. That was fantastic. And it's impressive how much stuff is in our area that we just forget about or know about. I mean, we have a lot of outdoor stuff, but I know pickleball is big. I always forget about the college. It's a great track, and it's free, when it's bad weather. Yeah, you can go there and walk. So it's a great way. I forget all the resources that we have. And I'm definitely going to use the breathing mostly when I'm in traffic.
Yeah.
Although maybe not the best at it because you still have to be driving.
Right.
Definitely. All right. Let me figure out how to get back to my guy here. I apologize. Hold on. All right. So back to the hard stuff. Boring stuff. No. Interesting. So next part we'll talk about AFib. We'll talk about high blood pressure, heart failure, and then some heart valve issues just to kind of wrap things up. Atrial fibrillation, there's a lot of different heart arrhythmias that can occur. People can have PVCs, which are extra beats in the ventricles. They can have ventricular rhythms that are abnormal. But atrial fibrillation tends to be the most common, which is why I wanted to kind of talk about that this evening. So what are the symptoms of atrial fibrillation? A lot of times, well, not a lot of times, but it can be nothing at all. When I used to work in cardiology, we had people who were sent over by their primary care provider whose heart rate was 180 and they had no idea. They're like, I don't know why I'm here, but their heart rate was really fast, which is amazing. I'm like, you have a heart rate of a hummingbird. A lot of times though, people do have at least shortness of breath. They can have palpitations or extra beats. They can have some dizziness or just feel odd because their heart's not beating efficiently. So that's when you start to have those things. Sometimes chest pain, but a lot of times it's palpitations. Definitely talk with your provider about that. A lot of times, especially women, will have palpitations and you just think, it's just a palpitation, it'll go away. But it's really important to diagnose atrial fibrillation. One of the biggest risk factors of atrial fibrillation in general is increases your risk of stroke.
Imagine that.
I know, and we have our stroke person here, so. But that's really one of the main reasons to know. You know, you want to know as well, because if you have a lot of uncontrolled heart rates that's really fast, it can also be very hard on your heart muscle and can weaken it over time. But the biggest thing you want to know is your risk because of the stroke risk. So what can lead to atrial fibrillation or increase your risk? Basically, being alive and getting older is your biggest risk factor in a lot of ways. Unfortunately, as we get older, we're just all at an increased risk for developing atrial fibrillation. Second, I would say, is obstructive sleep apnea. Obstructive sleep apnea is very hard on your system, period. It increases your risk of high blood pressure, heart failure, of coronary disease. It is, undiagnosis can be very detrimental. But it's apt, if you go in and get a diagnosis of AFib, guaranteed you're most likely going to get a sleep study because it goes so correlated, they're so hand in hand. Alcohol can sometimes trigger people to go into atrial fibrillation. Smoking increases your risk. Diabetes, thyroid issues. If you have hyperthyroid, you can end up sometimes, that can be one of the reasons you have AFib. Stress and family history actually can contribute to your risk of atrial fibrillation. So treatments, sorry it's a little backwards on the slide, but treatments, you want to treat your sleep apnea, so using CPAP. Rate control medications, these are all done with cardiology, so you would have a cardiology referral and they would assess things. Blood thinners, you're going to be on blood thinners usually, which like Eliquis or Xarelto, to decrease that risk of stroke. Sometimes antiarrhythmics, sometimes you go through what's called a cardioversion, which is where they actually shock your heart and they put it back into a normal rhythm. So AFib, you can kind of think of it like a short circuit. So like we talked about the atrium before, the atrium are on top and the ventricles on the bottom. So normally your heart rhythm starts with an area on the top. We'll say this is the right atrium, left atrium, and the ventricles. So you have what's called the SA node that fires off and sends a beat through your atrium and they contract. And then there's another node, kind of think of it like a control boxes in your house. So there's another one right above the ventricles. So once this SA node fires off, then it goes to what's called the AV node above the ventricles. That fires and then the ventricles contract. So atrium contract and then the ventricles contract. So when you have AFib, you kind of have this short circuit throughout the atrium and they're just bombarding that second node and just some of those rhythms get through. But so the reason why you have increased risk of stroke is because the atrium normally contract very controlled fashion. Atrium contract, ventricles contract. Atrium contract, ventricles. In AFib, they're just kind of wiggling. So they don't contract and push that blood out as efficiently. So that's why you have that increased risk of having strokes. So that's why it's really important to diagnose. Sometimes you get what's called an ablation. That's where they go through and try and find those short circuits and kind of stop them, cut them, and not cut them, burn them is the best way to put it. Yeah, burn baby. No. But they try and burn them so that that conduction can't get through that area. And then of course, treating your thyroid. So high blood pressure. We've talked kind of a lot about that. I won't go too far into it. But another reason it's important to know, it increases your risk of coronary disease, but also increases your risk of heart failure. When you have your ventricle that's squeezing, we talked about the left ventricle, there's a tube called the aorta that comes out of there. If your heart's squeezing and the pressure in your aorta is 200, that ventricle has to overcome that pressure to try and push the blood out of your heart into the vessels of your body. So it's kind of like a weightlifter. Over time, the muscle gets bigger and bigger, and when in the heart, you don't really want that. It can actually lead to where you have stiffness of the heart, it doesn't flex as well. So that's also a reason to really control your blood pressure. But again, also we talked about how it affects the coronaries, higher risk of stroke. If your blood pressure gets too high, you can actually have what's called a hemorrhagic or a bleeding stroke. Very bad.
It's the number one risk for stroke, hypertension.
See? Number one risk for stroke, hypertension. So super important. And the problem is, you may not know you have it, and so that's why it's so important to check your blood pressure. Some people just like, oh, I took my blood pressure med, but I feel fine now, so I stopped it. And so we're like, wait a minute, that's not how this works. You gotta keep taking it. Now, if you have sleep apnea and you treat it, or you have, if you're quite overweight and you treat it, sometimes you can get off of medications for your blood pressure, but never stop them without the guidance of your provider, your physician or provider. Again, causes sleep apnea, high salt diet, race, genetics, anxiety. We talked about how important it is to manage your stress. That can certainly have a huge effect. Smoking, energy drinks. Those are very prominent right now. And actually, I was reading not that long ago, a little bit of an aside. So women, as we get older and go into postmenopausal and stuff like that, energy drinks are so much worse. Because one of the things I didn't talk about, women, they have small vessel disease, and those energy drinks can really affect that, but it really can elevate your blood pressure, which has a significant effect on those little tiny vessels within the heart. So they are not good. Let's see. Treatments, we talked about medications, of course, are usually number one, but again, treating your sleep apnea, weight loss can sometimes do it, managing stress, and having a low salt diet.
And also exercise.
And exercise. Yeah, walking. Getting out there moving. Heart failure. So heart failure basically is when your heart muscle is not working efficiently. There are two types. Systolic, which is where the heart muscle is not squeezing as well as it should. So it should squeeze pretty vigorously, but in systolic, it's kind of sometimes not moving very much at all. And that tends to not allow very efficient blood being ejected out of the heart. Then diastolic is where the heart is very stiff, and that's where we talked about hypertension. It's almost like a weightlifter. In a bad way though, that heart muscle gets really thick and it doesn't flex, it's just too stiff. What can be symptoms? You can have fluid on the lungs, which makes you feel short of breath. You can have gurgling sensation with frothy sputum they call it, where you have this fluid almost coming out of your lungs. Fatigue, leg swelling, that's a big one. Causes, so heart attacks can certainly weaken the heart muscle. That's why you definitely want to control it. We talked about uncontrolled blood pressure. Fast heart rates that aren't controlled, again, over time can sometimes weaken the heart. Alcohol sometimes has been shown to weaken the heart as well, in some people, not everybody, but in some people. Then congenital, which means you could be born with issues, bad heart valves, and lots of what we call PVCs. So one thing to do, you want to watch your salt when you have heart failure, salt intake, because that makes you swell up and increase your fluid within your system, control your blood pressure, and then medications. There's GLP-1s again. Oh, this is just a brief thing of showing kind of how you can tell a little bit. The heart muscle is, so over here this is normal, obviously this is the heart failure, you can tell just how it's labeled. But in the normal heart, it should be, again, vigorously pumping blood out of the heart. And in heart failure, it just doesn't always pump it out. There's something called an ejection fraction, which is how much the heart squeezes, and it should be 50 to 65. I've seen people who have it 10 to 20, and you think, wow, is that possible? But it happens. All right, sorry, let me get back to the screen here. Oh, accidentally hit it. Oh wait, hold on. Okay. Heart valve. So just briefly, we'll touch on this. There are basically two types of heart valve issues. Either there's one called stenosis, which is where the heart valves don't open. They're supposed to open well. Sometimes they just open a little bit. That's usually when they have stenosis or they're stiff. Or you can have what's called regurgitation, which is where instead of everything moving forward, it tends to also move back because the valves are leaky. They don't work very well. As far as risks for those, sometimes just being born with certain types of valves can increase your risk of that. Having rheumatic fever as a child, some connective tissue disorders, sleep apnea can increase the risk, because having increased pressure within the chest can increase the risk of those valves not always functioning appropriately. Symptoms, sometimes none. Women can sometimes have palpitations when they have what's called mitral valve prolapse, which is when one of the valves doesn't close appropriately. And we could get more detailed of that, but I won't go through that now. If you ever have questions, if you're online at some point watching this, you can always put in questions in the comments below. We can always answer those questions. Treatments, there's lots of treatments. They used to have to go in and have open surgery in order to fix valves, but now there's a lot of things that can actually be done in a cath lab, so a lot less invasive to help treat valves. Pretty impressive. I remember I used to work in heart surgery a long time ago, and I was at a conference and they were talking about doing valves in the cath lab, and I thought, there's no way. Well, I was wrong. They are doing it in the cath lab. It's pretty incredible. And this I just thought was a really cool picture, so I put that in there. You can kind of see the heart muscles squeezing, and these are the atrium, and if you look, this is actually a valve. You can see it opening in through here, and this is up in the aorta, going up to the carotids. It's pretty cool.
Very cool picture.
And this is a side view, so this is your spine over here, and that would be your front of your chest, and that's your shoulder up there. Just a cool picture.
Well, the fact that you don't even have to think, your body does that naturally.
I know, it does it all the time. We don't ask it, it just does it. So take care of your heart now so we can keep up with your dreams later. And basically just remember, there's a lot of things we can do to try and offset a lot of the problems that can happen with our heart. We don't think there are, but there's a lot you can do in your lifestyle, myself included, that can change, how we do things to prevent or at least delay these things from happening. Thank you. And that is it.
Pleasure.
Okay.